I've always wanted to be a doctor since I was little, and I love being able to have the hands-on experience to be able to influence someone's life in a positive manner.
My mom was a nurse in the emergency room, so she definitely inspired me. And then in about 4th grade, she was diagnosed with multiple sclerosis. So I definitely saw kind of her primary care doctor, a neurologist, really guide her through such a difficult time and really help advocate for her. So I wanted to take that role as a physician.
Scripps Mercy is a phenomenal place to train. The hospital cares for a whole range of patients of all diverse backgrounds and the underserved. Our residents enjoy working with each other and care for each other. Our faculty loves to teach, and the residents develop strong positive relationships with the faculty. And finally, our residents enjoy working with the nurses and the other allied health professionals.
We have lots of opportunities for educational conferences, lots of good teaching on the floors, lots of great teaching in the outpatient clinics. So we have a strong focus on education. And in addition to that, I would say that it is just a very friendly place to work. People genuinely care about each other, they care about the patients, and they really want what's best for everyone.
Scripps has a reputation for being known for being one of the best transitional year programs in California. Scripps offers a lot of unique opportunities with electives that we can take. We only require about 6 to 7 months of inpatient rotations on wards and on ICU, and the rest of the time can be spent doing electives that you enjoy. And Scripps provides such a breadth of variety for electives that you can pick and choose what really suits your own interests.
I first heard about Scripps through a medical school classmate of mine, and he spoke very highly about the program and said how happy he was here. And then when I came for the interview day, I saw how happy all of the residents were. And then when I met Dr. Higginson, our amazing program director, I knew that it was a place I wanted to be. And also, I grew up in San Diego and my family's all here, so it seemed like a perfect fit.
Our ideal candidate is someone who is an excellent team player, someone who works well with others, who looks out for their co-interns and medical students, someone who is compassionate and provides care to patients that is compassionate. One of the highlights of a training opportunity here involves the CLUE program, which is Cardiovascular Limited Ultrasound Program. This is something that any of our transitional interns are welcome to participate in and can even become certified in by the end of their year. This is an additional training experience outside of the general residency program. And this offers insights and teaches residents how to use the cardiovascular limited ultrasound to obtain information about the patient's cardiovascular state. And it's an adjunct to the physical exam. It's one of the things that was kind of created here in San Diego and is San Diego is well known for. So residents are able to participate in that. Residents also do a lot of procedures here. So if you're looking for a program that has procedural experience and opportunities, this is definitely one of them. We teach the procedures to all of the interns, and they have the opportunity to perform them on patients in our hospital.
So a typical day for me on the wards would involve sign out, which is at 7 a.m. And obviously if there are more complicated patients or if you have more patients on your list, you might want to come a little bit earlier than 7 a.m. But we pre-round on our patients, and then we have rounds between 8 and 8:30. And then after that, we have what's called multidisciplinary rounds, where we meet with case managers, social workers, physical therapists, and kind of just talk about what the plan is for the patient for the day. And then after that, we work on our notes, we work on putting in orders and calling the consultants that we need to call. And then we every day have really interesting cases that are presented at morning report, and then also noon conferences where we get lectures from various attendings and also residents. And then after that, you kind of work on a lot of your discharges as well as admitting new patients from the ER if you're on call.
And we see a very wide range of patients, a very diverse patient population. And patients come to us sometimes with medical problems that might not be seen elsewhere. And our staff is equally diverse, the physicians that work here are diverse, and so you might not get that level of diversity at other locations.
Being so close to the border, we end up taking care of a lot of patients who are from diverse cultural backgrounds. There's a lot of Hispanic, African American, Asian patients, and it really teaches you how to be empathetic and also to deal with different patients from different cultures and to be understanding of where they come from. Sometimes we might not be able to speak the same language, but every room does have a translator phone which is readily available in order to help communicate with the patient.
I think this program is special for a couple of reasons. First, I think we provide really sound educational opportunities in whatever field a transitional intern may be going into. So we provide excellent training in the core specialties of internal medicine and pediatrics, but then each individual candidate gets to choose other electives that may meet their needs. So if they're going into radiology, they may wish to do rotations that would serve them well. We also offer plenty of electives in other specialties such as ophthalmology, dermatology, cardiology. There's lots of opportunities for elective time, and that is helpful for residents when they come here. We have the opportunity for you to work with pediatrics and adult patients, which isn't found in a lot of programs. We have excellent collaboration with research throughout the city and lots of opportunities to do research if that's something that you're interested in. Our hospital is certified in STEMI care and also stroke care, and so you have the opportunity to work at a very high level with these medical issues that come in commonly.
I think Scripps is really special in that everyone in this hospital is really, really, really nice, and also it feels like we're part of one big family.
So I think other residents should definitely consider coming here, and I'll give you a couple granular reasons why. In terms of the schedule, we're only required to do 6 to 6.5 months of hard rotation, so ICU or wards, and then you also have an ER rotation and an urgent care rotation. But besides that, you get to do a lot of electives, up to 3.5 months of electives. So I felt like that was a great way to explore my career interests. I'm going into dermatology, so I got to do, peds derm, derm path, a research elective. So I felt like it was very flexible in a way that I could really cater it towards my interests. Other than that, I think people are really supportive here. People are happy. The hours are good, and there's a good work-life balance, and I'm definitely happy here.
Scripps Mercy has been characterized by both the Joint Commission and the Accreditation Council on Graduate Medical Education as a hospital with heart. That's really true. Everybody here really cares for each other. The doctors, the residents, the nurses, administration, and everyone really cares for our patients. So it's really not just a job, it's a calling.
We all look out for each other. We have each other's backs. We're a small enough place that we can count on each other. We know each other by name, and it really is a nice place to train because of that. I tell the interns, once you are part of a family, you're always a part of our family, and we really enjoy that. Others have described our hospital as the hospital with heart, and we really feel that that's true. We provide compassionate care to all patients, regardless of anything. We're here to serve, and we're here to care for them, and we all come here knowing that that's what we want to do.
Scripps Mercy is definitely the hospital with heart, and you can see that every day on the wards, and how passionate the nurses, the doctors, social workers, case managements, the pastors, everyone that takes care and cares for our patients really does it with passion and a lot of empathy, and you can see that every day.
Scripps Mercy prepares residents to go into the world and practice and teach and continue to do research and enjoy positions of great prestige, including department chairs and chiefs of medical staffs, and be real leaders in their communities.
While here in our program, residents make lots of connections within the community with attending physicians. They then likely go somewhere else for their definitive training in the specialty that they're going into. And many of them do end up coming back to Scripps for employment and later on based on the experiences that they had here previously. This program offers a TY intern great academics in a very friendly environment, focus on education, focus on patient care, and the added benefit of living in San Diego. And honestly, I'm a perfect example of this. I came out here from Ohio 21 years ago for my internal medicine residency training here, and I just haven't left. This is a wonderful place to be. You work very hard while you're here in the hospital for sure, but when you're off, and there are so many great things to do in San Diego. If you're interested in the beach, you've got the beach. If you're interested in skiing, there's the mountains that you can easily get to, and literally everything in between. It's a great place when you have downtime to spend.
There's a lot of opportunities for surfing, if that's what you're into, kayaking, there's sea lions, there's the San Diego Zoo, the Wild Animal Park. SeaWorld is all just around the corner.
Obviously, you have the beach. That's definitely a huge plus. A lot of great hikes, a lot of great food, a lot of great tacos at the border, but Asian food in the Convoy District. There's a lot of places to explore.
I think that's something that Scripps has taught me very well is how to be efficient and organized, because that's one of the most important characteristics that you can have as an effective intern. Being able to prioritize tasks efficiently, know what to do when to put in discharge orders, how to talk to a patient about what medications they're going out on, and about how to write notes efficiently in order to convey what you want to say to all the consult services in a succinct manner. And I think that Scripps has really prepared me well for these tasks.
I learned that I was able to care for a lot of challenging and complex patients and take on, a greater patient load than I anticipated, especially in the beginning of the year. But I think that speaks to just how great the training is here and how much I've learned so far.
The biggest surprise for me about residency is how close everyone is in the hospital. Not only your colleagues, your other transitional year interns and the categorical interns, but also the attendings and the consult services, the nurses as well. Everyone really works together as part of a multidisciplinary team in order to care effectively for the patient. We have a very, very robust system of care managers and social workers who help manage our patients so that we have a very safe discharge for our patients. They help coordinate rehab facilities, skilled nursing facilities, home PT, home OT, and it really helps us in our discharge planning for the patients.
I would say what is most memorable for me was having the opportunity to care for patients towards their end of life when I was on my ICU rotation. So there's always a couple patients, that will stick with you forever. And I had a young guy in his 20s with HIV, with metastatic Kaposi sarcoma, as well as a 30-year-old with metastatic ovarian cancer. And they both ended up passing away. And I think it was just a real privilege to be able to take care of them in their end of life, and that will always be something I remember.
So if you're looking for a transitional year internship, I urge you to consider our program. We offer excellent clinical training in our very busy emergency department, the busiest in the county. And there in our hospital, we also are certified for stroke and STEMI care. Our transitional year internship offers experiences in both adult and pediatrics, which is one of the unique features of a transitional year internship.
It will really prepare you well for the next step of your medical career.
We provide a great foundation of general medicine, but also allow you to cater your electives and your year to your career goals in a very nurturing environment, very supportive. And I'm very happy here. I feel like we have a good work-life balance, so I would highly recommend it.
In the course of my 47 years in medicine, I've experienced the joy of taking care of patients, of continuing to learn, of doing research, and of teaching. I hope as my graduates go into the world, they experience all of that same joy, learning how to grow professionally and learning how to provide excellent care for their own patients.